All right, future nurse, we have been focusing on fundamental topics this week. Let's dive into this NCLEX question of the day. So a nurse is preparing a patient for an invasive procedure that requires a sterile field. Which of the following actions indicate contamination of that sterile field that is being prepared? Select all that apply. So let's go through each of these options and treat it like a true or false. So option A, the patient is anxious about the procedure and is facing you and asking questions towards you as you're prepping the sterile field. That is a very wordy way of me trying to say that they are talking over the sterile field. If there is conversation, sneezing, coughing over the sterile field, that is contamination. And if the patient doesn't have a mask on, you can no longer use that sterile field. Now, option B, a fellow nurse reaches across your body to drop a pair of sterile forceps. Now, anybody who reaches over a sterile field is contaminating it, so this is also a correct response. Option C, the provider touches the outer 0.5 inches of the sterile field with his or her sterile gloves. Now, this is a tedious detail, but it is important to know that this is a correct response. There is a 1-inch border that goes along the sterile field that is not considered sterile. So if you're touching anywhere outside of that 1-inch border, you are no longer in the sterile field. Option D, a bottle with sterile water is placed inside the sterile field after being poured into the designated area. So for example, I'm going to use my eye drops here. If the provider who is prepping the sterile field or the nurse asks another fellow nurse to pour a sterile container of water into the sterile field, this bottle, if it's being held by the person who's not preparing it, is not sterile. So this actual item can't be dropped into the sterile field, but the contents within it is considered sterile. So this is a correct option because you have contaminated the sterile field if you drop that bottle into the sterile field. I did my best to try and word that correctly. I hope that it makes sense. Long story short, if you take a bottle from outside of the sterile field, but inside is sterile water, and you would just pour the sterile water in, that bottle shouldn't be put back into that sterile field. It should be kept outside. And option E, while waiting for the provider, the nurse touches his or her sterile gloved hand with the other just above the waist. This is appropriate practice. It is not a correct answer because it does not cause contamination. Usually, as the nurse or anybody who's prepping the sterile field is waiting, they'll hold their two hands right at their torso. We don't want it too below the waist and we don't want it too high above the chest. And if your two hands have sterile gloves on, they can touch each other. All right, future nurse, I hope you learned something from today. Remember, go follow me on Instagram and YouTube. I have all these videos just in case that TikTok ban comes back.